The UAP cannot assess the client's fundus. The number one reason for a non-midline fundus is a full bladder. MS. GLADA cannot delegate assessment, teaching, evaluation, medication administration, or an unstable client to the UAP. 2. The client with the HELLP syndrome is unstable, therefore, Ms. GLADA should not delegate these vital signs to the UAP. 3. Ms. GLADA cannot delegate teaching to the UAP. 4. MS. GLADA cannot delegate medication administration to the UAP. 7.1. The float nurse should be able to address the psychosocial concerns of the mother and family. The client has no physiological problems, so the float nurse could care for this client. Often, the mother with a fetal demise is transferred to a medical surgical unit so she does not have to hear babies crying. 2. A boggy uterus indicates a potentially life-threatening situation and requires an experienced postpartum nurse to care for this client. 3. This client is potentially hemorrhaging and requires a more experienced nurse to care for her. 4. There are many legal issues surrounding an adoption as well as caring for the mother who is giving up her child. This client should be assigned a nurse more experienced in postpartum care. 8.1. The flu vaccine is made using duck eggs, therefore, Ms. Judy should question the administration of this vaccine to a client who is allergic to eggs, not tomatoes. 2. The nurse would not question administering the hepatitis B vaccine to a mother who is breastfeeding because one-day-old infants receive the vaccine. 3. Regam should be administered to the client since the baby is Rh positive. This will help prevent erythroblastosis fetal ASIS in the woman's next pregnancy. 4. The nurse would question administering this medication because a positive titer means the client is immune to rubella, German measles. 9.1. Mongolian spots are blue or purple-colored splotches on the baby's lower back and buttocks. The spots are caused by a concentration of pigmented cells that usually disappear in the first 4 years of life. This newborn does not need to be assessed first. 2. A port wine stain is a flat pink dash, red dash, or purple-colored birthmark. These are caused by a concentration of dilated tiny blood vessels called capillaries. The most effective way of treating port wine stains is with a special type of laser done when the baby is older. This newborn does not need to be assessed first. 3. Erythema toxicum is a red rash on newborns that is often described as flea bites. The rash is common on the chest and back, but may be found all over. It does not require any treatment and disappears by itself in a few days, therefore, Ms. Kathy does not need to assess this newborn first. 4. A cephalohematoma results when there is bleeding between the periosteum and the skull from pressure during birth. The firm swelling, edema, is not present at birth but develops within the first 24 to 48 hours. Any time a client is bleeding, it warrants intervention by the nurse. 10.1. When the infant is placed in the supine position, the infant should extend the arm and leg on the side to which the head is turned and then flex the extremities on the other. This is known as the tonic neck reflex or fencing reflex, which is normal for the newborn. The newborn remaining in a fetal position when supine warrants further intervention to assess for neurological problems. 2. The Babinski reflex is elicited by stroking the lateral sole of the foot from the heel forward. Normal reflex is that the toes flare outward and the big toe dorsiflexes. This is a normal response for an infant but is abnormal in an adult, indicating neurological deficit in the adult. Therefore, this does not warrant immediate intervention. 3. The stepping reflex is intact when the nurse places the baby on a flat surface. The baby will walk by placing one foot in front of the other. This is expected and does not warrant intervention by Ms. Judy. 4. The grasp reflex is elicited by placing a finger on the infant's open palm. The hand will close around the finger. Newborn infants have strong grasps and can almost be lifted from the examination table if both hands are used. This would not warrant intervention. Chapter 11 Women's Health Management 331 Scenario Answers 333 12 People are like stained glass windows. They sparkle and shine when the sun is out, but when the darkness sets in, their true beauty is revealed only if there is light from within. Elizabeth Kubler-Ross 1. The nurse is working in the emergency department, ed., of a children's medical center. Which client should the nurse assess first? 1. The 1-month-old infant who has developed colic and is crying. 2. The 2-year-old toddler who was bitten by another child at the daycare center. 3. The 6-year-old school-age child who was hit by a car while riding a bicycle. 4. The 14-year-old adolescent whose mother suspects her child is sexually active. 2. The 8-year-old client diagnosed with a vaso-occlusive sickle cell crisis is complaining of a severe headache. Which intervention should the nurse implement first? 1. Administer 6 L of oxygen via nasal cannula. 2. Assess the client's neurological status. 3. Administer a narcotic analgesic by intravenous push, IVP. 4. Increase the client's intravenous, 4, rate. 3. The 6-year-old client who has undergone abdominal surgery is attempting to make a pinwheel spin by blowing on it with the nurse's assistance. The child starts crying because the pinwheel won't spin. Which action should the nurse implement first? 1. Praise the child for the attempt to make the pinwheel spin. 2. Notify the respiratory therapist to implement incentive spirometry. 3. Encourage the child to turn from side to side and cough. 4. Demonstrate how to make the pinwheel spin by blowing on it. 4. The nurse is caring for clients on the pediatric medical unit. Which client should the nurse assess first? 1. The child diagnosed with type 1 diabetes who has a blood glucose level of 180 mg/dl. 2. The child diagnosed with pneumonia who is coughing and has a temperature of 100 degrees Fahrenheit. 3. The child diagnosed with gastroenteritis who has a potassium, K+, level of 3.9 milliequivalent/L. 4. The child diagnosed with cystic fibrosis who has a pulse oximeter reading of 90%. Questions. Pediatric Health Management 5. The nurse has received the AM shift report for clients on a pediatric unit. Which medication should the nurse administer first? 1. The 3rd dose of the aminoglycoside antibiotic to the child diagnosed with methicillin-resistant Staphylococcus aureus, MRSA. 2. The IVP steroid methylprednisolone, solumedrol, to the child diagnosed with asthma. 3. The sliding scale insulin to the child diagnosed with type 1 diabetes mellitus. 4. The stimulant methylphenidate, Ritalin, to a child diagnosed with attention deficit hyperactivity disorder, ADHD. 6. The nurse enters the client's room and realizes the 9-month-old infant is not breathing. Which interventions should the nurse implement? Prioritize the nurse's actions from first, 1, to last, 5. 1. Perform cardiac compression 30:2. 2. Check the infant's brachial pulse. 3. Administer 2 puffs to the infant. 4. Determine unresponsiveness. 5. Open the infant's airway. 7. The 3-year-old client has been admitted to the pediatric unit. Which task should the nurse instruct the unlicensed assistive personnel, UAP, to perform first? 1. Orient the parents and child to the room. 2. Obtain an admission kit for the child. 3. Post the child's height and weight at the hob. 4. Provide the child with a meal tray. 8. The clinic nurse is preparing to administer an intramuscular, IM, injection to the 2-year-old toddler. Which intervention should the nurse implement first? 1. Immobilize the child's leg. 2. Explain the procedure to the child. 3. Cleanse the area with an alcohol swab. 4. Administer the medication in the thigh. 9. The nurse is writing a care plan for the 5-year-old child diagnosed with gastroenteritis. Which client problem is priority? 1. Imbalanced nutrition. 2. Fluid volume deficit. 3. Knowledge deficit. 4. Risk for infection. 10. Which data would warrant immediate intervention from the pediatric nurse? 1. Proteinuria for the child diagnosed with nephrotic syndrome. 2. Petechiae for the child diagnosed with leukemia. 3. Drooling for a child diagnosed with acute epiglottitis. 4. Elevated temperature in a child diagnosed with otitis media. 11. Which client should the pediatric nurse assess first after receiving the AM shift report? 1. The 6-month-old child diagnosed with bacterial meningitis who is irritable and crying. 2. The 9-month-old child diagnosed with tetralogy of Fallot, TOF, who has edema of the face. 3. The 11-month-old child diagnosed with Reye syndrome who is lethargic and vomiting. 4. The 13-month-old child diagnosed with diarrhea who has sunken eyeballs and decreased urine output. 334. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 12. The pediatric clinic nurse is triaging telephone calls. Which client's parent should the nurse call first? 1. The 4-month-old child who had immunizations yesterday and the parent is reporting a high-pitched cry and a 103 degrees Fahrenheit fever. 2. The 8-month-old whose parent is reporting the child is pulling on the right ear and has a fever. 3. The 2-year-old child who has patent ductus arteriosus whose parent reports running out of digoxin. 4. The 3-year-old child whose mother called and reported her daughter may have chickenpox. 13. The parent of a 12-year-old male child with a left below the knee cast calls the pediatric clinic nurse and tells the nurse, "My son's foot is cold and he told me it feels like his foot is asleep." Which action should the nurse implement first? 1. Prepare to bifurcate the left below the knee cast. 2. Tell the parent to bring the child to the office. 3. Instruct the parent to elevate the left leg on 2 pillows. 4. Notify the child's orthopedist of the situation. 14. Which child requires the nurse to notify the healthcare provider? 1. The 1-year-old child with iron deficiency anemia who has dark-colored stool. 2. The 3-year-old child with phenylketonuria, PKU, whose parent does not feed the child any meat or milk products. 3. The 5-year-old child with rheumatic heart fever who is having difficulty breathing. 4. The 7-year-old child diagnosed with acute glomerulonephritis who has dark tea-colored urine. 15. The pediatric nurse on the surgical unit has just received AM shift report. Which client should the nurse assess first? 1. The 3-week-old child 1 day postoperative with surgical repair of a myelomeningocele who has bulging fontanelles. 2. The 3-month-old child 2 days postoperative temporary colostoma secondary to Hirschsprung's disease who has a moist, pink stoma. 3. The 9-month-old child with a cleft palate repair who is spitting up formula and refusing to eat. 4. The 4-year-old child 1 day postoperative for repair of hypospadias who has clear ember urine draining from indwelling catheter. 16. The charge nurse has assigned a staff nurse to care for an 8-year-old client diagnosed with cerebral palsy. Which nursing action by the staff nurse would warrant immediate intervention by the charge nurse? 1. The staff nurse performs gentle range of motion, ROM, exercises to extremities. 2. The staff nurse puts the client's bed in the lowest position possible. 3. The staff nurse takes the client in a wheelchair to the activity room. 4. The staff nurse places the child in semi-Fowler's position to eat lunch. 17. The nurse and the unlicensed assistive personnel, UAP, are caring for clients on the pediatric unit. Which action by the nurse indicates appropriate delegation? 1. The nurse requests the UAP to check the circulation on the child with a cast. 2. The nurse asks the UAP to feed an infant who has just had a cleft palate repair. 3. The nurse has the UAP demonstrate a catheterization for a child with a neurogenic bladder. 4. The nurse checks to make sure the UAP's delegated tasks have been completed. Chapter 12 Pediatric Health Management 335 Questions 18. The nurse on a pediatric unit has received the AM shift report and tells the unlicensed assistive personnel, UAP, to keep the 2-year-old child NPO for a procedure. At 0830, the nurse observes the mother feeding the child. Which action should the nurse implement first? 1. Determine what the UAP did not understand about the instruction. 2. Tell the HCP the UAP did not follow the nurse's direction. 3. Ask the mother why she was feeding her child if the child was NPO. 4. Notify the dietary department to hold the child's meal trays. 19. The charge nurse on the 6-bed pediatric burn unit is making shift assignments and has 1 registered nurse, RN, 1 scrub technician, 1 unlicensed assistive personnel, UAP, and a unit secretary. Which client care assignment indicates the best use of the hospital personnel? 1. The RN performs daily whirlpool dressing changes. 2. The unit secretary transcribes the HCP's orders. 3. The scrub technician medicates the client prior to dressing changes. 4. The UAP places the current laboratory results on the chart. 20. The RN and the UAP are caring for clients on a pediatric surgical unit. Which tasks would be most appropriate to delegate to the UAP? Select all that apply. 1. Pass dietary trays to the clients. 2. Obtain routine vital signs on the clients. 3. Complete the preoperative checklist. 4. Change linens on the client's beds. 5. Document the client's intake and output. 21. Which client should the charge nurse on the pediatric unit assign to the most experienced nurse? 1. The 4-year-old child diagnosed with hemophilia receiving factor VIII. 2. The 8-year-old child with headaches who is scheduled for a CT scan. 3. The 6-year-old child recovering from a sickle cell crisis. 4. The 11-year-old child newly diagnosed with rheumatoid arthritis. 22. The charge nurse is making shift assignments on a pediatric oncology unit. Which delegation/assignment would be most appropriate? 1. Delegate the unlicensed assistive personnel, UAP, to obtain routine blood work from the central line. 2. Instruct the licensed practical nurse, LPN, to contact the leukemia support group. 3. Assign the chemotherapy certified RN to administer chemotherapeutic medication. 4. Have the dietitian check the meal trays for the amount eaten. 23. The nurse observes the unlicensed assistive personnel, UAP, bringing a cartoon video to a 6-year-old female child on bed rest so that she can watch it on the television. Which action should the nurse take? 1. Tell the UAP that the child should not be watching videos. 2. Explain that this is the responsibility of the child life therapist. 3. Praise the UAP for providing the child with an appropriate activity. 4. Notify the charge nurse that the UAP gave the child videos to watch. 24. Which newborn should the nurse in the neonatal intensive care unit, NICU, assign to a new graduate who has just completed an NICU internship? 1. The 1-day-old infant diagnosed with a myeloma meningocele. 2. The 2-week-old infant who was born 6 weeks premature. 3. The 3-hour-old infant who is being evaluated for esophageal atresia. 4. The 1-week-old infant diagnosed with tetralogy of Fallot. 336. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 25. The newly hired nurse is working on a pediatric unit and needs the unlicensed assistive personnel, UAP, to obtain a urine specimen on an 11-month-old infant. Which statement made to the UAP indicates the nurse understands the delegation process? 1. Be sure to weigh the diaper when obtaining the urine specimen. 2. Do you know how to apply the urine collection bag? 3. Use a small indwelling catheter when obtaining the urine specimen. 4. I need for you to get a urine specimen on the infant. 26. Which task is most appropriate for the pediatric nurse to delegate to the unlicensed assistive personnel, UAP? 1. Ask the UAP to orient the parents and child to the room. 2. Tell the UAP to prepare the child for an endoscopy. 3. Request the UAP to log roll the client who had a spinal surgery. 4. Instruct the UAP to assess the child's developmental level. 27. Which behavior by the unlicensed assistive personnel, UAP, warrants intervention by the nurse? 1. The UAP weighs the child's diaper on a scale and records the urine output on the intake and output, INO, sheet. 2. The UAP sits with the child while the parent goes down to the cafeteria to get something to eat. 3. The UAP bathes the child with congenital dislocated hip with the Pavlik harness on the child. 4. The UAP applies wrist restraints on the 7-month-old who is 1 day postoperative cleft palate repair. 28. The nurse is caring for pediatric clients. Which tasks are most appropriate to assign to an unlicensed assistive personnel, UAP, and/or a licensed vocational nurse, LPN? Select all that apply. 1. Instruct the LPN to teach the parent of a child new diagnosed with type 1 diabetes. 2. Tell the UAP to apply an ice collar to the child who is 1 day postoperative tonsillectomy. 3. Ask the UAP to place ointment on a child's diaper rash around the anal area. 4. Request the LPN to double-check the medication dose for the child receiving an antibiotic. 5. Tell the LPN to transcribe the healthcare provider's orders for the child with cystic fibrosis. 29. The nurse is discharging a 4-month-old child with a temporary colostomy. Which intervention should the nurse implement? 1. Request the UAP to complete the discharge written documentation. 2. Tell the LPN to show the parent how to irrigate the colostomy. 3. Ask the UAP to remove the child's intravenous catheter. 4. Request the UAP to escort the parent and child to the car. 30. The unlicensed assistive personnel, UAP, tells the nurse the child with Down syndrome who is 2 days postoperative appendectomy is having pain. Which intervention should the nurse implement first? 1. Tell the UAP to check the child's vital signs. 2. Assess the child's abdominal dressing and pain immediately. 3. Notify the healthcare provider. 4. Check the MAR for last time pain medication was administered. Chapter 12 Pediatric Health Management 337 Questions 31. The 8-year-old male child in the pediatric unit is refusing to ambulate postoperatively. Which intervention would be most appropriate? 1. Give the child the option to ambulate now or after lunch. 2. Ask the parents to insist the child ambulate in the hall. 3. Refer the child to the child developmental therapist. 4. Tell the child he can watch a video game if he cooperates. 32. The clinic nurse overhears a mother in the waiting room tell her 6-year-old son, "If you don't sit down and be quiet, I am going to get the nurse to give you a shot." Which action should the nurse implement? 1. Do not take any action because the mother is attempting to discipline her son. 2. Tell the child the nurse would not give him a shot because the mother said to. 3. Report this verbally abusive behavior to Child Protective Services. 4. Tell the mother this behavior will cause her son to be afraid of the nurses. 33. The parents of an infant born with Down syndrome are holding their infant and crying. The father asks, "I have heard children like this are hard to take care of at home." Which referral would be most appropriate for the parents? 1. The website for the National Association for Down Syndrome. 2. The hospital chaplain. 3. A Down syndrome support group. 4. A geneticist. 34. The charge nurse on the pediatric unit hears the overhead announcement of Code Pink, infant abduction, newborn nursery. Which action should the charge nurse implement? 1. Send a staff member to the newborn nursery. 2. Explain the situation to the clients and visitors. 3. Continue with the charge nurse's responsibilities. 4. Station a staff member at all the unit exits. 35. The mother of a 4-year-old child diagnosed with Duchenne's muscular dystrophy is overwhelmed and asks the nurse, "I have been told a case manager will come and talk to me. What will they do for me?" Which statement indicates the nurse understands the role of the case manager? 1. You will have a case manager so that the hospital can save money. 2. She will make sure your child gets the right medication for muscular dystrophy. 3. She will help you find the resources you need to care for your child. 4. The case manager helps your child to have a normal life expectancy. 36. The nurse is assigned to the Pediatric Unit Performance Improvement Committee. The unit is concerned with 4 infection rates. Which action should the nurse implement first when investigating the problem? 1. Contact central supply for samples of 4 start kits. 2. Obtain research to determine the best length for 4 dwell time. 3. Identify how many 4 infections have occurred in the last year. 4. Audit the charts to determine if hospital policy is being followed. 37. The clinic nurse is discussing a tubal ligation with a 17-year-old adolescent with Down syndrome. The adolescent does not want the surgery, but her parents, who are also in the room, are telling her she must have it. Which statement by the nurse would be an example of the ethical principle of justice? 1. I think this requires further discussion before scheduling this procedure. 2. You will not be able to have children after you have this procedure. 3. You should have this procedure because you could not care for a child. 4. You can refuse this procedure and your parents can't make you have it. 338. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 38. The school nurse has referred an 8-year-old student for further evaluation of vision. The single mother has told the school nurse she does not have the money for the evaluation or glasses. Which action by the nurse would be an example of client advocacy? 1. Tell the mother the child cannot read the board. 2. Refer the mother to a local service organization. 3. Ask the mother if the family is on Medicaid. 4. Loan the mother money for the examination. 39. The emergency department, Ed. Nurse is scheduling the 16-year-old client for an emergency appendectomy. Which intervention should the nurse implement when obtaining permission for the surgery? 1. Withhold the narcotic pain medication until the client signs the permit. 2. Have the client's parent or legal guardian sign the operative permit. 3. Explain the procedure to the client and the parents in simple terms. 4. Get a visitor from the ED waiting area to witness the parent's signature. 40. The unit manager has been notified by Central Supply that many client items are missing from stock and have not been charged to the client. Which action should the nurse manager implement regarding the lost charges? 1. Send out a memo telling the staff to follow the charge procedures. 2. Form a performance improvement committee to study the problem. 3. Determine whether the items in question are being restocked daily. 4. Schedule a staff meeting to discuss how to prevent further lost charges. 41. Which child's behavior warrants notifying the child developmental specialist? 1. The 1-year-old child who cries when the parent leaves the room. 2. The 2-year-old child who can talk in 2 or 3-word sentences. 3. The 3-year-old child who is toilet trained for bowel and bladder. 4. The 4-year-old child who throws frequent temper tantrums. 42. Which child should the nurse assign to the new graduate who has just completed orientation to the pediatric unit? 1. The 5-year-old child admitted in a sickle cell crisis whose patient-controlled analgesia, PCA, pump is not controlling the child's pain. 2. The 6-year-old child in Russell's traction for a fractured femur who has insertion pin sites that are inflamed and infected. 3. The 12-year-old child who is newly diagnosed with type 1 diabetes who needs medication teaching. 4. The 16-year-old female diagnosed with scoliosis who is being admitted for insertion of a spinal rod in the morning. 43. Which action by the emergency department, Ed. Nurse warrants intervention by the charge nurse? 1. The nurse is elevating the right arm of a child who appears to have fractured the wrist. 2. The nurse is notifying Child Protective Services for a child who is suspected of being sexually abused. 3. The nurse is assessing the tonsils on a 4-year-old child who has a sore throat and is drooling. 4. The nurse is obtaining a midstream urine specimen for the child who is complaining of burning upon urination. Chapter 12 Pediatric Health Management 339 Questions 1. Regular insulin 6 units. 2. Regular insulin 18 units and NPH 20 units. 3. Regular insulin 10 units and NPH 20 units. 4. Regular insulin 8 units. 45. Which interventions should the nurse implement to help establish a nurse/parent relationship? Select all that apply. 1. Include the parents when developing the plan of care for their child. 2. Encourage the parents to hold their child as much as possible. 3. Allow the parents to verbalize their feelings of fear and anxiety. 4. Tell the parents to never leave while the child is hospitalized. 5. Request the parents to bring toys from home the child will enjoy. 46. The nurse is caring for clients on the pediatric unit. Which child would warrant a referral to the early childhood development specialist? 1. The 9-month-old child who says only mama or dada. 2. The 11-month-old child who walks hanging onto furniture. 3. The 8-month-old child who sits by leaning forward on both hands. 4. The 4-month-old infant who turns from the abdomen to the back. 47. The 10-year-old child diagnosed with leukemia is scheduled for a bone marrow aspiration. Which intervention is most important when obtaining informed consent for the procedure? 1. Obtain assent from the child. 2. Have the parent sign the permit. 3. Refer any questions to the HCP. 4. Witness the signature on the permit. 48. The 13-year-old client has just delivered a 4-pound baby boy. The stepfather of the client becomes verbally abusive to the nurse when he is asked to leave the room. The client is withdrawn and silent. Which legal action should the nurse implement? 1. Call hospital security to come to the room. 2. Contact Child Protective Services. 3. Refer the child to the social worker. 4. Ask the client whether she feels safe at home. 44. The day shift nurse is preparing to administer 0730 medications to the 12-year-old child diagnosed with type 1 diabetes. The child's 0730 blood glucose level is 252. Which insulin coverage should the nurse administer? 340. Prioritization, delegation, and management of care for the NCLEX-RN registered exam account number, client's name, 13,456 allergies, NKA date medication 23012007007012 sliding scale regular insulin AC and HS 150 no insulin 151 to 204 units 201 to 256 units 251 to 308 units 301 notify H. CP 10 units regular insulin 0730 20 units NPH insulin signature / initials day nurse RN / DN night nurse RN / NN 49. The fire alarm on the pediatric unit has just started sounding. Which action should the charge nurse implement first? 1. Call the hospital operator to find out the location of the fire. 2. Ensure that all visitors and clients are in the room with the door closed. 3. Prepare to evacuate the clients and visitors down the stairs. 4. Make a list of which clients are not currently on the unit. 50. A nurse overhears 2 other nurses talking about a client in the hospital dining room. Which action should the nurse implement first? 1. Notify the HIPAA officer about the breach of confidentiality. 2. Immediately report the 2 nurses to their clinical manager. 3. Document the situation in writing and submit to the Chief Nursing Officer, CNO. 4. Tell the 2 nurses they are violating the client's confidentiality. 51. The nurse is caring for newborns in the nursery. Which newborn warrants immediate intervention by the nurse? 1. The 8-hour-old newborn who has not passed meconium. 2. The 15-hour-old newborn who is slightly jaundiced. 3. The 4-hour-old newborn who is jittery and irritable. 4. The 10-hour-old newborn who will not stop crying. 52. At 1300, the nurse is assessing a 12-year-old child who is complaining of abdominal pain and rating it as a 5 on a scale of 1 to 10. Which intervention should the nurse implement? 1. Administer 30 ml of Maalox-Po. 2. Administer 650 mg of Tylenol-Po. 3. Administer 5 mg of hydrocodone-Po. 4. Administer 2 mg of morphine IVP. 53. The nurse who has never worked on the maternity ward has been pulled from the surgical unit to work in the newborn nursery. Which assignment would be most appropriate for the nurse to accept? 1. Perform an assessment on the newborn. 2. Assist the pediatrician with a circumcision. 3. Gavage feed a newborn who is 8 hours old. 4. Transport newborns to the mother's room. Chapter 12 Pediatric Health Management 341 Questions Account Number, Client's Name, 123,456 Allergies, NKDA Height, 60 inches Weight, 98 pounds State Medication 23012070007012 1500 1501 2300 Maalox 30 ml Q1 hour PRN Acetaminophen, Tylenol, 650 mg po Q 6 hours PRN Hydrocodone, Vicodin, 0600 N 5 mg po PRN Pain Q4, 6 hours Morphine 2 mg IVP PRN Pain Q4 hours Signature/initials Day Nurse RN/DN Night Nurse RN/NN 54. The nurse is instructing the unlicensed assistive personnel, UAP, on gross motor skill activity that is appropriate for a developmentally delayed 9-month-old infant. Which activity should the nurse delegate to the UAP? 1. Help the child to sit without support. 2. Teach the child to catch the beach ball. 3. Reward the child with food for sitting up. 4. Teach the child to blow a kiss. 55. Which incident should the primary nurse report to the clinical manager concerning a violation of information technology guidelines? 1. The nurse keeps the computer screen turned away from public view. 2. The nurse researches medications using the online formulary. 3. The nurse shares the computer access code with another nurse. 4. The nurse logs off the computer when leaving the terminal. 56. The nurse is caring for clients in a pediatric emergency department, ed. Which client should the nurse assess first? 1. The child with a dog bite on the left hand who is bleeding. 2. The child who has a laceration on the right side of the forehead. 3. The child with a fractured tibia who will not move the foot. 4. The child who has ingested a bottle of prenatal vitamins. 57. The nurse is caring for a client in a children's medical center. Which behavior indicates the nurse understands the pediatric client's rights? 1. The nurse administers an injection without talking to the child. 2. The nurse covers the 5-year-old child's genitalia during a code. 3. The nurse discusses the child's condition with the grandparents. 4. The nurse leaves an uncapped needle at the client's bedside. 58. The home health nurse is planning the care of a 14-year-old client diagnosed with leukemia who is receiving chemotherapy. Which psychosocial problem is priority for this client? 1. Diversional activity deficit. 2. High risk for infection. 3. Social isolation. 4. Hopelessness. 59. The nurse is administering 4 fluids to a 3-year-old client. Which action by the nurse would warrant intervention by the charge nurse? 1. The nurse places the 4 on an infusion pump. 2. The nurse does not use a volume-controlled chamber. 3. The nurse checks the child's foresight every hour. 4. The nurse labels the 4 tubing with date and time. 60. The nurse is caring for clients on a psychiatric pediatric unit. Which action by the nurse is reportable to the State Board of Nursing? 1. The nurse leaves for lunch and does not return to complete the shift. 2. The nurse fails to check the ID band when administering medications. 3. The nurse has had 3 documented medication errors in the last 3 months. 4. The nurse has admitted to having an affair with another staff member. 61. The nurse is working in a free healthcare clinic. Which client's situation warrants further investigation? 1. The child diagnosed with rheumatoid arthritis who is wearing a copper bracelet. 2. The mother of a child with a sunburn who is using juice from an aloe vera plant on the burn. 3. The grandmother who reports rubbing Vicks VapoRub on the child's chest for a cold. 4. The father who tells the nurse that the child receives a variety of herbs every day. 342 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 62. The unlicensed assistive personnel, UAP, tells the primary nurse that the 4-year-old child is alone in the room because the mother went to the cafeteria to get something to eat. Which action should the nurse implement first? 1. Arrange for the mother to have a tray sent to the room. 2. Go to the cafeteria and ask the mother to return to the room. 3. Tell the UAP to stay with the child until the mother returns. 4. Notify social services that the mother left the child alone. 63. The nurse is evaluating an 18-month-old child in the pediatric clinic. Which data would indicate to the nurse that the child is not meeting tasks according to Erikson's stages of psychosocial development? 1. The child stamps his or her foot and says no frequently. 2. The child does not interact with the mother. 3. The child cries when the mother leaves the room. 4. The child responds when called by name. 64. Which statement by the female charge nurse indicates she has an autocratic leadership style? 1. You must complete all the AM care before you take your morning break. 2. I don't care how the work is done as long as it is completed on time. 3. I would like to talk to you about your ideas on a new staffing mix. 4. I think we should have a potluck lunch tomorrow because it is Saturday. 65. The nurse is evaluating the care of a 5-year-old client with a cyanotic congenital heart defect. Which client outcome would support that discharge teaching has been effective? 1. The mother makes the child get up when squatting. 2. The child is playing in the dayroom without oxygen. 3. The father buys the child a baseball and a bat. 4. The nurse finds unopened packs of salt on the meal tray. 66. The nurse is administering morning medications on a pediatric unit. Which action should the nurse take first when preparing to administer medication to the client? Tr. 1. Check the client's apical pulse rate. 2. Ask the parent for the baby's date of birth. 3. Look to see if a digoxin level has been drawn. 4. Call the healthcare provider to discuss the digoxin. Chapter 12 Pediatric Health Management 343 Questions. Account number, allergies, milk and dairy. Client name, Tr. 594-8726. Products. Height, 21 inches. Weight in pounds, 15. Date of birth, 2 weeks ago. Weight in kg, 6.82. Date, today. Medication 2301-07000701-1500 1501-2300 Digoxin 0.125 mg/5 ml 0900 Q Depot 250 ml 0.3 3% 0215 NN Viaduct Dextrose IV Buretrol set up at 10 ml/hour and 4 pump signature / initials night nurse day nurse RN/NNRN/DN 67. The nurse working in a pediatrician's office is preparing to administer the initial HIV vaccination to a 2-month-old infant. Which is the preferred site for the injection? 1A2, B3, C4, D68. The nurse is preparing to administer an intravenous piggyback to an 8-year-old child. The child has N4 running at 45 ml per hour. The medication comes prepared in 50 ml of NS. At which rate should the nurse set the 4 pump? Underscore 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 69. The unconscious 4-year-old child is brought to the emergency department by paramedics. The child has bruises covering the torso in varying stages of healing. The nurse notes small burn marks on the child's genitalia. Which actions should the nurse implement? Select all that apply. 1. Notify Child Protective Services. 2. Ask the parent how the child was injured. 3. Perform a thorough examination for more injuries. 4. Tell the parents that the police have been called. 5. Prepare the child for skull X-rays and a CT scan. 70. The 24-month-old toddler is admitted to the pediatric unit with vomiting and diarrhea. Which interventions should the nurse implement? Rank in order of performance. 1. Teach the parent about weighing diapers to determine output status. 2. Show the parent the call light and explain safety regimens. 3. Assess the toddler's tissue turgor. 4. Place the appropriate size diapers in the room. 5. Take the toddler's vital signs. 344 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam ABCD Chapter 12 Pediatric Health Management 345 Clinical Scenario Ms. Laura is the charge nurse in a pediatric emergency department, ed. She has 3 registered nurses working, Ms. Polly, Mr. Aaron, and Ms. Ruth. There are 2 unlicensed assistive personnel, UAP, Ms. Michelle, and Ms. Diane. 1. Which child should Ms. Laura assess first? 1. The 1-month-old infant who crying, is inconsolable, and has inspiratory retractions. 2. The 4-year-old toddler with cystic fibrosis who has a pulse oximeter reading of 93%. 3. The 6-year-old child with gastroenteritis who has a potassium level of 3.6 milliequivalent/L. 4. The 14-year-old child with type 2 diabetes with a blood glucose level of 210 mg/dl. 2. Which task should Ms. Laura delegate to Ms. Michelle, the UAP? 1. Take the vital signs of a child who is having a sickle cell crisis. 2. Place oxygen via nasal cannula on a child diagnosed with cystic fibrosis. 3. Obtain the weight of the child who is diagnosed with nephrotic syndrome. 4. Escort the child diagnosed with traumatic brain injury, TBI, to the intensive care unit, ICU. 3. Ms. Laura is observing Mr. Aaron administer an intramuscular, IM, injection to a 2-year-old toddler. Which action by Mr. Aaron warrants intervention by Ms. Laura? 1. He immobilizes the child's leg. 2. He explains the procedure to the child. 3. He places the syringe in the sharps container. 4. He recaps the needle after administering the medication. 4. Which task should Ms. Ruth not delegate to the Ms. Diane, the UAP? 1. Document the intake and output, INO, on the child diagnosed with congestive heart failure, CHF. 2. Feed the child who is experiencing an acute exacerbation of inflammatory bowel disease, IBD. 3. Elevate the child's leg who just had a cast applied for a fractured right ankle. 4. Take the child's catheterized urine specimen to the laboratory. 5. Which client should Ms. Laura assign to Ms. Polly, the most experienced pediatric emergency department nurse? 1. The 1-year-old child who is tugging at the right ear and has a temperature of 100.4 degrees Fahrenheit. 2. The 6-year-old child who is wheezing and complaining of chest tightness. 3. The 8-year-old female child who is complaining of burning when she urinates. 4. The 11-year-old child with bilateral crackles and a productive cough. 6. The 13-year-old child is admitted to the emergency department with nickel rigidity, a positive Kernig's sign, a positive Brudzinski's sign, and an elevated temperature. Which intervention should Ms. Laura implement first? 1. Administer acetaminophen, Tylenol, PO with water. 2. Place the child in droplet isolation. 3. Prepare the child for a lumbar puncture. 4. Notify the hospital infection control nurse. 7. Mr. Aaron answers the phone and a distraught woman says, "My daughter just drank a bottle of cleaning solution." Which intervention should Mr. Aaron implement first? 1. Tell the mother to bring the child to the emergency department immediately. 2. Ask the mother how old the child is and how much the child weighs. 3. Ask the mother if she has syrup of ipecac that could be given to the child. 4. Tell Ms. Laura to call poison control immediately. Pediatric Clinical Scenario 8. The 8-year-old child is brought to the emergency department by his parents with a pencil penetrating the right eye. Which intervention should Ms. Laura implement first? 1. Remove the object with a lightly moistened gauze pad. 2. Ask the parents about child medical history and any known allergies. 3. Stabilize the pencil in place and patch the left eye. 4. Assess the child's vital signs and pulse oximeter reading. 9. Mr. Aaron is caring for a 7-year-old child who was hit in the head with a baseball. 1 hour ago the child had a 15 on the Glasgow Coma scale and now has a 12. Which intervention should Mr. Aaron implement first? 1. Notify the hospital neurologist immediately. 2. Document the findings in the chart. 3. Complete a Glasgow coma scale in 2 hours. 4. Place the child in the high Fowler's position. 10. Which client should Ms. Laura assign to Mr. Aaron, the least experienced nurse in the emergency department? 1. The child whose parent reports the child had a sore throat and is now drooling. 2. The child who has a distended abdomen and absent bowel sounds. 3. The child who has an edematous and contused right ankle. 4. The child whose parent reports the child has blood in his urine. 11. Which nursing task should Ms. Ruth delegate to Ms. Michelle, the UAP? 1. Escort the child who is being discharged via wheelchair out to the parent's car. 2. Determine if a child's growth and developmental level is on target. 3. Explain how to care for the below-the-knee cast to the parents. 4. Assist the healthcare provider to suture a child's leg laceration. 346. Prioritization, delegation, and management of care for the NCLEX-RN registered exam Chapter 12 Pediatric Health Management 347 TT Max characters 18. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The main sign of colic is intense crying, therefore, this is expected and would not warrant the nurses assessing the child first. 2. A human bite is dangerous, but it is not life-threatening. 3. The child hit by a car should be assessed first because he or she may have life-threatening injuries that must be assessed and treated promptly. 4. This client is not priority over a client with a physiological problem. Content, Pediatrics, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Assessment, Client Needs, Health Promotion and Maintenance, Cognitive Level, Analysis 2. 1. Administering oxygen may help decrease the sickling of the cells, but this should not be the first intervention to address the client's headache. 2. Because the client is complaining of a headache, the nurse should first rule out cerebrovascular accident, CVA, by assessing the client's neurological status and then determine whether it is a headache that can be treated with medication. 3. Prior to administering any pain medication to a client, the nurse must first assess the client to determine whether the pain is what is expected with the disease process or whether it is a complication that requires further nursing intervention. 4. Only after CVA has been ruled out should the nurse medicate the client. Adequate hydration will help decrease sickling of the cells, but this is not the first intervention to address the client's pain. Content, Pediatrics, Category of Health Alteration, Hematology, Integrated Processes, Nursing Process, Implementation, Client Needs, Health Promotion and Maintenance, Cognitive Level, Application 3. 1. The nurse should always praise the child for attempts at cooperation even if the child did not accomplish what the nurse asked. 2. This action can be taken by the nurse after praising the child for the attempt. 3. This action is appropriate and should be implemented, but not before the nurse praises the child for the attempt. 4. The nurse can demonstrate the correct technique for the child, but not before praising the child for the attempt. Content, Pediatrics, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Implementation, Client Needs, Health Promotion and Maintenance, Cognitive Level, Application 4. 1. A 180 mg/dl glucose level for a child with type 1 diabetes is not life-threatening, and the nurse would not assess this child first. 2. The nurse would expect the child with pneumonia to have these signs/symptoms, therefore, the nurse would not assess this child first. 3. This is a normal potassium level, therefore, the nurse would not assess this child first. 4. A pulse oximeter reading of less than 93% is significant and indicates hypoxia, which is life-threatening, therefore, this child should be assessed first. Content, Pediatrics, Category of Health Alteration, Respiratory, Integrated Processes, Nursing Process, Assessment, Client Needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, when deciding which client to assess first, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 5.1. The third dose of an antibiotic would not be priority over sliding scale insulin because insulin must be administered prior to the breakfast meal. 2 routine medications have a 1-hour leeway before and after the scheduled time, therefore, this medication does not have to be administered first. 3 sliding scale insulin is ordered AC, which is before meals, therefore, this medication must be administered first after receiving the AM shift report. 4 routine medications have a 1-hour leeway before and after the scheduled time. Therefore, this medication does not have to be administered first. Content: Pediatric, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Answers and Rationales. Answers 348. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam Process, Implementation, Client Needs, Physiological Integrity, Pharmacologic and Parenteral Therapies, Cognitive Level, Application 6. Correct answer: 4, 5, 3, 2, 1. 4. The nurse must first determine the infant's responsiveness by thumping the baby's feet. 5. The nurse should then open the child's airway using the head tilt chin lift technique, with care taken not to hyperextend the neck. Then the nurse should look, listen, and feel for respirations. 3. The nurse then administers quick puffs of air while covering the child's mouth and nose, preferably with a rescue mask. 2. The nurse should determine whether the infant has a pulse by checking the brachial artery. 1. If the infant has no pulse, the nurse should begin chest compressions using 2 fingers at a rate of 30:2. Content: Pediatrics, Category of Health Alteration, Respiratory, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Synthesis. 7. 1. The first intervention after the child is admitted to the unit is to orient the parents and child to the room, the call system, and the hospital rules, such as not leaving the child alone in the room. 2. This task is within the scope of the UAP, but it is not priority over orienting the child/parents to the room. 3. The height/weight should be posted in case the client codes, but this can be done after the child/parents are oriented to the room. 4. The child should receive a meal tray, but not before orientation to the room. Content: Pediatrics, Category of Health Alteration, Safety, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. 8. 1. The nurse should immobilize the child's leg, but it is not the first intervention. 2. The nurse must explain any procedure in words the child can understand. It does not matter how old the child is. 3. This is an appropriate intervention, but it is not the first intervention. 4. This is an appropriate intervention, but it is not the first intervention. Content: Pediatrics, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Application 9. 1. This is not the priority problem because lack of fluids is more life-threatening to a child than lack of food. 2. The child diagnosed with gastroenteritis is at high risk for hypovolemic shock resulting from vomiting and diarrhea. Therefore, maintaining fluid and electrolyte homeostasis is priority. 3. Knowledge deficit is a psychosocial diagnosis, and although it is important to teach the parents and child, it is not priority over a physiological problem. 4. The child already has an infection, thus there is no risk. Content: pediatrics, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker should use Maslow's hierarchy of F needs to determine the client's priority problem. Physiological problems are priority. 10.1. The child diagnosed with nephrotic syndrome would be expected to have proteinuria. 2. The child diagnosed with leukemia would be expected to have petechiae. 3. Drooling indicates the child is having trouble swallowing, and the epiglottis is at risk of completely occluding the airway. This warrants immediate intervention. The nurse should notify the HCP and obtain an emergency tracheostomy tray for the bedside. 4. A child with an ear infection would be expected to have an elevated temperature. Content, pediatrics, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. When deciding which client to assess first, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 11.1. Irritability and crying are expected signs/symptoms for a child with bacterial meningitis, therefore, this child does not need to be assessed first. 2. The child with TOF would be expected to have signs of congestive heart failure, so this child would not be assessed first. Chapter 12 Pediatric Health Management 349-3. The child with Reye syndrome would present with lethargy and vomiting, so this child would not be assessed first. 4. Sunken eyeballs and decreased urine output are signs of dehydration, which is a life-threatening complication of diarrhea. Therefore, this child should be assessed first. Content, pediatrics, category of health alteration, endocrine, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. The test taker must determine if the signs/symptoms are normal for the disease process. If the signs/symptoms are normal, then the nurse should not assess the child first. If 2 or more are not expected, then the nurse must determine which is more life-threatening, needs further assessment, or needs notification of the health care provider. 12. 1. A high fever and high-pitched crying may indicate a reaction to the immunizations, therefore, this parent needs to be called first to bring the child to the clinic. 2. This child probably has an ear infection, which needs to be seen but is not priority over a reaction to immunizations. 3. The nurse needs to call in a prescription for the digoxin but not prior to calling the parent whose child is having a reaction to an immunization. 4. The child may need to be seen but primarily kept in isolation, so this parent does not need to be called first. Content, pediatrics, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker must determine if the signs/symptoms are normal for the disease process. If the signs/symptoms are not normal, then the nurse should call this parent first. 13.1. These are signs/symptoms of neurovascular compromise and the cast may need to be cut, bifurcated, but it is not the first intervention. 2. The child should be brought to the office but the parent should first attempt to decrease edema by elevating the extremity. 3. The nurse should first take care of the client's body by having the parent elevate the left leg. 4. The orthopedist should be notified but it is not the first intervention. Content, pediatrics, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions, when the question asks the nurse which intervention should be implemented first, it means all the interventions are possible. The nurse should implement an action that will help the client's situation first. 14.1. The child with iron deficiency anemia would be taking an iron elixir, which causes the stool to be black. 2. The child with PKU should not eat any meats, milk, dairy, and eggs since the child lacks the enzyme that breaks down phenylalanine. 3. A complication of rheumatic heart disease is valvular disorders that may be manifested by respiratory problems. Therefore, the nurse should notify the child's healthcare provider. 4. The child with acute glomerulonephritis would be expected to have dark urine. Content: Pediatrics, Category of Health Alteration, Cardiovascular, Integrated Processes, Nursing Process, Assessment, Client Needs, Health Promotion and Maintenance, Cognitive Level, Analysis. Making nursing decisions, the nurse should notify the healthcare provider of any signs/symptoms that are not expected with the disease process or are signs of a complication. 15.1. Bulging fontanelles is a sign of increased intracranial pressure, which is a complication of neurological surgery, therefore, this child should be assessed first. 2. A moist, pink stoma is normal. Therefore, this child does not need to be assessed first. 3. This child needs to be assessed but is not priority over a child with a surgical, possibly life-threatening, complication. 4. The child will have an indwelling urinary catheter and clear amber urine is normal, so this child does not need to be assessed first. Content: Pediatrics, Category of Health Alteration, Neurological, Integrated Processes, Nursing Process, Assessment, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Analysis. Making nursing decisions, the test taker must determine if the signs/symptoms are expected for the surgical procedure. If the signs/symptoms are not expected, this child should be assessed first. If two are not expected, answers 350. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Then the child with a life-threatening complication should be assessed first. 16.1. It is appropriate for the nurse to perform ROM exercises to help prevent contractures, specifically scissoring of the legs. This action would not require intervention. 2. Safety issues should always be addressed, and keeping the bed in the lowest position may prevent injury to the child. 3. Taking the child to the activity room is being a client advocate and would not warrant intervention. 4. The child should be positioned upright to prevent aspiration during meals, therefore, this action would require the charge nurse to intervene. Content: Pediatrics, Category of Health Alteration, Neurological, Integrated Processes, Nursing Process, Assessment, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Analysis. 17. 1. The UAP cannot assess a client. Therefore, this is an inappropriate delegation. 2. The child with a cleft palate repair is at risk for choking or damaging the incision site, therefore, this task should not be delegated to a UAP. 3. Demonstrating is teaching, and the UAP cannot teach a client. 4. The last step of delegating to a UAP is for the nurse to evaluate and determine whether the delegated tasks have been completed and performed correctly. This indicates the nurse has delegated appropriately. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. Making nursing decisions, when delegating to a UAP, the nurse must follow the 4 rights of clinical delegation: the right task, to the right person, using the right communication, and providing the right feedback. The right feedback includes determining whether the delegated tasks were performed correctly. 18.1. Communication to the UAP must be clear, concise, correct, and complete. The nurse must determine why there was a lack of communication, which resulted in the child receiving food, therefore, this action should be implemented first. 2. The nurse retains ultimate accountability for any delegated tasks and cannot blame the UAP for the child's being fed by the mother. The HCP needs to be notified to cancel the procedure. 3. The nurse should talk to the mother about why the child was being fed, but the nurse must first determine whether the UAP told the mother not to feed the child and that the child was to be given nothing by mouth. 4. This action is too late to take care of the situation. Content, management, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 19. 1. The scrub technician is assigned to perform daily whirlpool dressing changes, which is a lengthy procedure. Therefore, assigning the 1 RN to this task would be inappropriate because he or she cannot be unavailable for an extended period of time. 2. One of the responsibilities of the unit secretary is to transcribe the HCP's orders, but the licensed nurse retains total responsibility for the correctness and accuracy of the transcribed orders. 3. The scrub technician cannot administer medications. 4. The unit secretary and laboratory personnel are responsible for posting laboratory data into the client's charts. The UAP should be on the unit taking care of the clients. Content, pediatrics, category of health alteration, integumentary, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 20. 1, 2, 4, and 5 are correct. 1. The UAP can pass the dietary trays to the clients because it does not require judgment. 2. One of the responsibilities of the UAP is taking routine vital signs on clients. 3. The nurse must complete the preoperative checklist because it requires nursing judgment to determine whether the client is ready for surgery. 4. One of the responsibilities of the UAP is changing bed linens. 5. The UAP can document the client's intake and output, but the UAP cannot evaluate the numbers. Content, pediatrics, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, application chapter 12 pediatric health management 351-21. 1. The administration of blood products does not require the most experienced nurse. 2. Preparing a child for a routine procedure does not require the most experienced nurse. 3. The child recovering from a sickle cell crisis would not require the most experienced nurse. 4. The child newly diagnosed with a chronic disease, which will have acute exacerbations, requires extensive teaching, therefore, the most experienced nurse should be assigned to this child and family. Content, pediatrics, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 22. 1. Only a nurse can withdraw blood from a central line. 2. The social worker or case manager is responsible for referring clients to support groups. This is not an expected responsibility of a floor nurse/LPN. 3. Only chemotherapy-certified RNs can administer antineoplastic, chemotherapeutic medications. This is a national minimal standard of care according to the Oncology Nursing Society. 4. The dietitian is responsible for ensuring that the proper food is provided along with evaluating the child's nutritional intake, not checking the amount of food eaten. This is the responsibility of the nursing staff. Content, pediatrics, category of health alteration, oncology, integrated processes, nursing process, planning client needs, safe and effective care environment, management of care, cognitive level, synthesis 23. 1. A 6-year-old child on bed rest needs an appropriate activity to help with distraction. A cartoon video would be an age-appropriate activity. 2. The child life therapist is responsible for recreational and developmental activity for the hospitalized child, but any staff member should address the child's psychosocial needs. 3. Part of the delegation process is to evaluate the UAP's performance of duties, and the nurse should praise any initiative on the part of the UAP in being a client advocate. 4 videos are one of the few age-appropriate activities to occupy a 6-year-old on bed rest. Therefore, there is no reason to notify the charge nurse. Content, management, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 24. 1. The newborn with the myelomeningocele has a portion of the spinal cord and membranes protruding through the back and is at risk for hydrocephalus and meningitis. This client should be assigned to a more experienced nurse. 2. The new graduate who has completed the NICU internship should be able to care for a premature infant because care is primarily supportive. 3. Esophageal atresia, a congenital anomaly in which the esophagus does not completely develop, is a clinical and surgical emergency. It puts the newborn at risk for aspiration because the upper esophagus ends in a blind pouch with the lower part of the esophagus connected to the trachea. This newborn should be assigned to a more experienced nurse. 4. Tetralogy of Fallot is a cyanotic, congenital anomaly. It includes a combination of 4 defects of the heart, all of which result in unoxygenated blood being pumped into the systemic circulation. This newborn must be assigned to an experienced nurse. Content, pediatrics, category of health alteration, cardiac, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which client is the most stable, which makes this an accept question. 3 clients are either unstable or have potentially life-threatening conditions. 25.1. Weighing the diaper is the procedure for determining the infant's urinary output and is not part of the procedure for obtaining a urine specimen. 2. The NCSBN position paper in 1995 defined delegation as transferring to a competent individual the authority to perform a selected nursing task in a selected situation. The nurse retains the accountability for the delegation. The nurse must determine whether the UAP has the ability and knowledge to perform a task. This question clarifies whether the UAP has the ability to obtain a urine specimen. 3. Obtaining a urine specimen with an indwelling catheter on an 11-month-old infant would require more expertise than a UAP would have on the pediatric unit. Answers 352. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Furthermore, it does not determine whether the UAP understands how to do the procedure. 4. This statement does not determine whether the UAP understands how to perform the procedure of obtaining a urine specimen from an 11-month-old infant. Content, management, category of health alteration, management of care, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 26. 1. The UAP can orient the parents and child to the room, and demonstrate how to use the call light, how the bed works, or how the television works. 2. The UAP cannot prepare a child for endoscopy. This requires assessment and evaluation to determine if the child is ready for the procedure. 3. There must be at least 2 people to log roll a child, and the UAP cannot do this procedure alone. 4. The nurse cannot delegate assessment to the UAP. Content, pediatrics, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot delegate assessment, teaching. NG, evaluation, medications, or an unstable client to a UAP. 27.1. The UAP can weigh the diapers and obtain urine output. The nurse must evaluate the output. 2. A child under 12 years of age cannot be left alone in the room, and the UAP could stay with the child while the parent gets something to eat. 3. The Pavlik harness should not be removed, so bathing the child in the harness is appropriate and does not warrant intervention. 4. The 7-month-old should have elbow restraints, not wrist restraints. Elbow restraints prevent the child from putting fingers into the mouth, but allow the child to move the arms. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Assessment, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Analysis. Making nursing decisions, the nurse is responsible for supervising and evaluating the care the UAP provides to any clients. The nurse must intervene and correct the UAP's behavior. 28.2, 3, 4, and 5 are correct. 1. The nurse cannot assign teaching to the LPN. 2. The UAP can apply an ice collar since the client is stable. 3. The UAP can apply ointment to a diaper rash. It is a medication but it can be applied by the UAP. 4. The LPN can double-check a dose of medication. The nurse can assign medication administration to an LPN. 5. The LPN can transcribe a healthcare provider's orders. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. Making nursing decisions, the nurse cannot delegate assessment, teaching, NG, evaluation, medications, or an unstable client to a UAP. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to an LPN. 29.1. The nurse cannot delegate teaching to the UAP. 2. The LPN could teach a client how to irrigate a colostomy, but a 4-month-old is incontinent of stool, therefore, irrigating the colostomy is not done. 3. The LPN or nurse should remove the forecatheter of a 4-month-old child, not the UAP. 4. The UAP can escort the child and parents to the car. Content: Pediatrics, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Implementation, Client Needs, Health Promotion and Maintenance, Cognitive Level, Application. Making nursing decisions, the nurse cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to an LPN. Many questions on the NCLEX-RN registered are evaluating the test taker's knowledge of the disease process or surgical procedure, as well as delegation/assignments. 30. 1. The UAP can take vital signs but the nurse should assess the child to determine whether this is routine postoperative pain, expected, or whether a complication is occurring. 2. A rule of thumb: if anyone else gives the nurse information about a client, the Chapter 12 Pediatric Health Management 353 nurse should first assess the client before taking any further action. 3. The nurse may need to notify the HCP, but not before assessing the child. 4. The nurse may need to administer pain medication but not prior to assessing the child. Content: Pediatrics, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Application. Making nursing decisions, when the question asks, which interventio and should the nurse implement first, it means all or at least more than one option is plausible. Remember, if another person, a machine, or laboratory datum provides information about the client, the nurse should assess the client first. 31.1. The nurse should offer the child choices that ensure cooperation with the therapeutic regimen. The choices are when the child will ambulate, not whether the child will ambulate. 2. The nurse could ask the parents for help in making sure the client ambulates, but this may cause a rift in the nurse/parent/child relationship. This is not the most appropriate intervention. 3. The child development therapist could assist with activities that would encourage the client to ambulate, but the nurse should take control of the situation and ensure the client ambulates. This is not the most appropriate intervention. 4. This is bribery, and the nurse should not use this technique to ensure cooperation with the therapeutic regimen. Content: pediatric, category of health alteration, management of care, integrated processes, caring, client needs, safe and effective care environment, management of care, cognitive level. 32. 1. The nurse must take action or the child will be afraid of the nurse. 2. The nurse should discuss the inappropriate comment with the mother, not with the child. 3. If every nurse who overheard this type of comment reported it to Child Protective Services, it would only unnecessarily increase the workload in an already overloaded system. Furthermore, reporting perceived potential abuse to Child Protective Services is a very serious accusation. 4. The nurse should explain to the mother that threatening the child with a shot will cause the child to be frightened of healthcare professionals. This type of comment is inappropriate and should not be used to discipline a child. Content: pediatrics, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application. 33. 1. There is a website to obtain information about Down syndrome, but this type of referral would not be the most appropriate for parents who need to deal with emotional aspects of having a child with special needs. 2. The hospital chaplain is an important part of the multidisciplinary healthcare team but would not have specialized knowledge regarding caring for a special needs child. 3. According to the NCLEX-RN registered test plan, referrals are included in management of care. The most appropriate referral would be to a support group where other parents who have special needs children can share their feelings and provide advice on how to care for their child in the home. 4. Although Down syndrome results from a trisomy chromosome 21, it is primarily associated with maternal age over 35 years. Furthermore, a geneticist would not have specialized knowledge regarding caring for a special needs child. Content: pediatrics, category of health alteration, management of care, integrated processes, diagnosis, client needs, safe and effective care environment, management of care, cognitive level, knowledge. 34. 1. The newborn nursery does not need any more people in the area. Personnel are needed to monitor any and all exits. 2. The purpose of using code names to alert hospital personnel of emergency situations is to avoid panic among the clients and visitors. Therefore, the nurse should not explain the situation to the clients and visitors. 3. Anytime there is an overhead emergency announcement, the charge nurse is responsible for following the hospital emergency plan. 4. Code pink means an infant has been abducted from the newborn nursery. The priority intervention is to prevent the abductor from taking the child from the hospital, which can be prevented by placing a staff member at all of the unit exits. Content: pediatrics, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application. Answers 354. Prioritization, delegation, and management and of care. For the NCLEX-RN registered exam making nursing decisions, the nurse must be knowledgeable of hospital emergency preparedness. Students as well as new employees receive this information in hospital orientations and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on the safe and effective care environment. 35.1. Even though case management is a strategy to ensure coordination of care while reducing costs, the nurse should not share this with the mother. 2. The case manager is not responsible for ensuring that the client receives the correct medication, it is the responsibility of the HCP. 3. According to the NCLEX-RN registered test blueprint, questions on case management are included. The case manager will coordinate the care for a client with a chronic illness with other members of the multidisciplinary healthcare team. This attempts to prevent duplication of services and allows the mother to have a specific individual to coordinate services to meet the child's needs. 4. The life expectancy of a child with Duchenne's muscular dystrophy is approximately 25 years. The case manager is not responsible for helping the child have a normal life expectancy. Content, management of care, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, comprehension 36. 1. Although this would not be the first step in investigating a problem, this action may be initiated if it is determined to be the cause for the increase in infection rates. 2. The nurse should utilize evidence-based practice research when proposing changes because it is part of the performance improvement process, but it is not the first intervention when investigating the problem. 3. The first intervention is to determine the extent of the problem and who owns the problem. The NCLEX-RN registered test blueprint includes performance improvement, quality improvement, in the management of care content. 4. This action may need to be implemented once it is determined whether there is a problem with infection rates. However, this would be the second step in the process. Content, management, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, comprehension 37. 1. The ethical principle of justice is to treat all clients fairly, without regard to age, socioeconomic status, or any other variable, including clients with special needs. This statement supports the adolescent's right to her opinion even though she has Down syndrome. 2. If the adolescent needs clarification of the procedure, this would be an appropriate response, which is an example of the ethical principle of veracity or truth-telling. 3. This statement is an example of the ethical principle of paternalism, in which the nurse knows what is best for the client. 4. This is an example of autonomy, in which the client has the right to self-determination. The Nuremberg Code of Ethics specifically supports the rights of individuals with special needs against being forced to participate in procedures they do not want. Content, pediatrics, category of health alteration, reproductive, integrated processes, nursing process, evaluation, client needs, psychosocial integrity, cognitive level, synthesis 38. 1. Although this may be the case, this is not client advocacy, and doing so may make the mother feel guilty about not being able to afford glasses for her child. 2. This is an example of client advocacy because many local service organizations, such as the Lions Club or the Rotary Club, will subsidize the cost of the vision test and glasses. 3. Medicaid does not pay for glasses, and it is not the school nurse's business whether the family is on Medicaid. 4. The nurse should not loan the mother money because this crosses professional boundaries. Content, pediatrics, category of health alteration, neurosensory, integrated processes, nursing process, implementation, client needs, health promotion and maintenance cognitive level, application 39. 1. The 16-year-old client is not old enough to sign the permit. Therefore, pain medication would not be withheld. 2. Legally, a child under the age of 18 must have a parent or legal guardian sign for informed consent. The nurse should determine whether the child is aware of the situation and assents to the procedure. 3. The surgeon is responsible for explaining the procedure, the nurse is responsible for witnessing the signature on the operative permit. Chapter 12 Pediatric Health Management 355 4. The nurse is responsible for witnessing the signature. Having a visitor sign the operative permit is a violation of HIPAA. Content: Pediatrics, Category of Health Alteration, Gastrointestinal, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Application 40. 1. A written memo does not allow the staff to have input into how to correct the problem. This memo might lead to blaming and arguments among the staff. 2. The Performance Improvement Committee is designed to improve client care, not to address management issues. 3. This is implying that the unit manager does not believe the central supply lost charges. If the unit manager has this concern, it should be addressed directly with the central supply supervisor. 4. Because the staff is responsible for following the hospital procedure for charging for items used in client care, the unit manager should discuss this with staff to determine what should be done to correct the problem. Content: Management, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Application 41. 1. A 1-year-old child who cries when the parent leaves the room is developmentally on target. 2. The 2-year-old who can speak in 2 or 3-word sentences is developmentally on target. 3. The 3-year-old should be toilet trained by this age. 4. The toddler, age 1 to 3, is expected to throw temper tantrums, but a 4-year-old child should not be doing this. Therefore, the child is not developmentally on target and the child developmental specialist should be notified. Content: Pediatrics, Category of Health Alteration, Growth and Development, Integrated Processes, Nursing Process, Evaluation, Client Needs, Psychosocial Integrity, Cognitive Level, Synthesis. Making nursing decisions, the pediatric nurse must be knowledgeable of the normal developmental tasks for each age. The Joint Commission mandates all children in a pediatric unit must have a developmental assessment and intervention if the child is not on task. 42.1. The child with uncontrolled pain would require a more experienced nurse. 2. Infected skeletal pin sites can lead to osteomyelitis, which would require a more experienced nurse. 3. This child and parents require extensive teaching and should be assigned to a more experienced nurse. 4. The new graduate should be able to complete preoperative teaching and prepare the young client for surgery. This client is stable. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis. Making nursing decisions, an inexperienced nurse should be assigned the most stable client. 43.1. Elevating the arm to help decrease edema is an appropriate intervention and does not warrant intervention. 2. The nurse is legally obligated to notify CPS for any suspected child abuse. 3. A child who is drooling may have epiglottitis and opening the mouth may lead to respiratory distress. This action warrants intervention by the charge nurse. 4. The nurse needs to confirm a urinary tract infection by obtaining a urine specimen. Content: Pediatrics, Category of Health Alteration, Immunoinflammatory, Integrated Processes, Nursing Process, Assessment, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Analysis. Making nursing decisions, the test taker must be able to apply assessment data and interventions to determine if the action is appropriate. This is an NCLEX-RN registered style application question. 44.1. The nurse must administer the scheduled insulin dose along with the sliding scale coverage, therefore, this is the incorrect dose. 2. The nurse must administer the scheduled dose along with an additional 8 units, so the total dose is 18 units regular insulin and NPH 20 units. The nurse should not administer 2 injections to the child. 3. This is the scheduled dose and does not include the sliding scale coverage. 4. This covers the sliding scale coverage but not the scheduled dose. Content: Pediatrics, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis answers 356 prioritization, delegation, and management. NT of care for the NCLEX-RN registered exam making nursing decisions. This is a knowledge-based question concerning managing a child's disease. There are no test-taking hints for this type of question. 45 1 and 3 are correct. 1. Including the parents in developing the plan of care will help establish a positive relationship. 2. Holding their child will help with the child/parent relationship, but not with the nurse/parent relationship. 3. Allowing the parents to vent their feelings will help form a positive nurse/parent relationship. 4. The nurse must not make the parents feel guilty if they have to work while the child is hospitalized. A relative can stay with the child if parents have to work. 5. This will help the child/parent relationship, not the nurse/parent relationship. Content: Pediatrics, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application making nursing decisions. Select all that apply. Questions require the test taker to select MO. Than one option as a correct answer. There are no partial points given for partially correct answers. 46 1. The 9-month-old infant's language and cognitive skills include imitating sounds, saying single syllables, and beginning to put syllables together. Using mama and dada indicates this child is developmentally on target. 2. The 10 to 12-month-old infant can walk with one hand held or cruise the furniture, but will usually crawl to get places more rapidly. This behavior indicates the child is developmentally on target. 3. The 8-month-old infant should be able to sit steadily unsupported, therefore, this child is developmentally delayed and warrants a referral to the early childhood development specialist. Leaning forward on both hands to sit is normal for a 6-month-old. 4. The 4-month-old infant should be able to turn from the abdomen to back, therefore, this child is developmentally on target. Content: Pediatrics, category of health alteration, growth and development, integrated processes, nursing process, assessment, client needs, health promotion and maintenance, cognitive level, analysis 47. 1. The most important intervention for this child is to make sure the child has some control and input into the decision making. It is customary to obtain assent from children 7 years of age and older. Assent means the child has been fully informed about the procedure and concurs with those giving the informed consent. 2. The parents must sign the permit because the child is under age 18, but the most important intervention is to make sure the child is included and aware of decisions being made about his or her body. 3. The nurse may be able to clarify some of the child's or parent's questions and does not need to refer all questions to the HCP. 4. Witnessing the signature on the permit is required prior to the child's having surgery, but it is not the most important intervention. Content: Pediatrics, category of health alteration, hematology, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, comprehension 48. 1. The nurse should call hospital security when a client or visitor is being abusive, but this is not a legal action. 2. Legally, the nurse is required to report any suspected child abuse. A 13-year-old child who is having a baby and is withdrawn and silent along with a potential abuser who is trying to control access to the child should make the nurse suspect child abuse. 3. Referring the client to a social worker is not a legal action. 4. Asking the client whether she feels safe at home is an appropriate assessment question, but it is not a legal action. Content: Pediatrics, category of health alteration, obstetrics, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 49. 1. The charge nurse must first make sure that clients and visitors are safe. Someone will notify the charge nurse about the location of the fire. 2. Safety of the clients and visitors is priority, therefore, ensuring that they are in a room with the door closed is the first intervention. 3. The charge nurse may need to prepare for evacuation, but it is not the first intervention. 4. Although making a list of clients not currently on the unit is an appropriate intervention, the charge nurse must first ensure the Chapter 12 Pediatric Health Management 357 safety of the clients and visitors who are on the pediatric unit. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Comprehension 50. 1. The HIPAA officer can be notified of the breach of confidentiality, but the nurse must first confront the 2 nurses and correct the behavior. 2. The nurses can be reported to their clinical manager, but the nurse must first confront the 2 nurses and correct the behavior. 3. The situation can be documented in writing and turned into the HIPAA officer, not the CNO, but the nurse must first confront the 2 nurses and correct the behavior. 4. This is a violation of HIPAA, therefore, the nurse must first confront the 2 nurses and correct the behavior. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Application 51. 1. The nurse would not be concerned about not passing meconium until at least 24 hours after delivery. 2. The nurse would not be concerned about a newborn who is slightly jaundiced until after 24 hours after delivery, at which point the HCP would investigate to determine whether the jaundice is pathological. 3. A newborn who is jittery and irritable needs to be assessed first for possible hypoglycemia. The nurse could feed the newborn glucose water or provide more frequent, regular feedings. 4. Although the nurse should determine why the newborn will not stop crying, the newborn who is showing signs of hypoglycemia warrants immediate intervention. Content: Pediatrics, Category of Health Alteration, Endocrine, Integrated Processes, Nursing Process, Evaluation, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Synthesis 52. 1. An antacid is administered to neutralize gastric acidity and help with heartburn, not abdominal pain. 2. A non-narcotic analgesic is used to treat mild pain, a 2 to 4 on a pain scale. 3. A narcotic analgesic is used for moderate to severe pain, a 5 is considered moderate pain. The child received a dose at 0600, which relieved the pain for 7 hours, therefore, this would be the most appropriate medication. 4. An IVP narcotic analgesic should be administered for severe pain, that is, pain greater than 7 on a pain scale of 1 to 10. Content: Pediatrics, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Implementation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Application 53. 1. The nurse should not accept any assignment for which he or she is unqualified. A newborn assessment requires specialized knowledge and skills to detect potential complications. 2. The nurse who is not familiar with the procedure or the unit should not be assigned to assist a pediatrician to perform a procedure. 3. This is a dangerous procedure because the nurse must insert a tube into the newborn's stomach. A nurse who is not familiar with this procedure should refuse the assignment. 4. Any nurse can take an infant to the mother's room and check the bands to ensure the right infant is with the right mother. This is an appropriate task for a nurse who has never worked in the nursery. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis 54. 1. The 9-month-old infant should be able to sit without support. Therefore, the nurse should instruct the UAP to perform the developmental task of helping the child sit without support. 2. Teaching a child to catch a beach ball would be appropriate for a 15 to 18-month-old child, so the nurse should not instruct the UAP to perform this task. 3. The UAP should not use food as a reward or comfort measure because it may lead to childhood obesity. 4. Teaching a child how to blow a kiss is a language/cognitive activity and will not help the child's gross motor development. Content: Pediatrics, Category of Health Alteration, Neurological, Integrated Processes, Nursing Process, Planning, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis 55. 1. Making sure no one can view the screen is an appropriate information technology guideline. Answers 358. Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 2. Researching medication online is ensuring safe and effective nursing care and shows that the nurse is keeping abreast of new medications. 3. According to the NCLEX-RN Registered Test Blueprint, the nurse must be knowledgeable of information technology. Giving another nurse his or her access code is a very serious violation of information technology guidelines and should be reported. 4. Logging off the computer is an appropriate information technology guideline. Content: Legal, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Application 56. 1. A dog bite is an emergency, but it is not life-threatening. Therefore, this child would not be assessed first. 2. The child with a head laceration must be assessed, but not before a child who might die of medication poisoning. 3. The child with a fractured tibia would not be expected to move the foot. 4. A child who ingested a bottle of prenatal vitamins presents a medication poisoning that is a potentially life-threatening situation. This child must be assessed first to determine how many vitamins were taken, how long ago they were taken, and whether or not the vitamins contained iron. The child's neurological status must also be assessed. Content: Pediatrics, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Assessment, Client Needs, Physiological Integrity, Reduction of Risk Potential, Cognitive Level, Analysis 57. 1. The pediatric client has the right to an explanation of procedures being done to his or her body. 2. The pediatric client has a right to be treated with dignity and respect. Just because the child is being coded does not mean the nurse should allow the child's body to be exposed to everyone in the room. 3. The pediatric client has a right to confidentiality, and the parents/legal guardians are the only individuals who have a right to the child's health information. Talking to the grandparents is a violation of HIPAA unless the parents have approved. 4. The nurse is responsible and accountable to protect the health, safety, and rights of the pediatric client. Leaving an uncapped needle at the bedside could cause serious harm to the child. Content: Pediatrics, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Evaluation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis 58. 1. Diversional activity deficit would be appropriate if the client did not have sufficient activities to keep him or her occupied. Most children of this age will watch television, play video games, or read books. 2. The client has leukemia and is receiving chemotherapy, which leads to an increased risk of infection. However, this is a physiological problem, not a psychosocial problem. 3. The client will be isolated from peers and schools because of the high risk of infection resulting from the immunosuppression secondary to chemotherapy and the disease process. At this stage, the child needs to be developing peer relationships and independence from parents. Therefore, social isolation is the priority psychosocial problem for this client. 4. The nurse should not identify hopelessness because childhood leukemia has a good prognosis. Content: Pediatrics, Category of Health Alteration, Oncology, Integrated Processes, Nursing Process, Planning, Client Needs, Psychosocial Integrity, Cognitive Level, Synthesis 59. 1. Placing the 4-line on an infusion pump helps to make sure the client does not receive an overload of 4 fluid. Most facilities require an 4 pump and volume control chamber when administering fluids in a pediatric clinic. 2. A volume control chamber, Buretrol, is a device that is used with children when administering 4 fluids. The chamber is filled with 1 hour's amount of fluid so that the child will not inadvertently receive an overload of fluid. Fluid volume overload is a potentially life-threatening situation in children. 3. The site should be checked frequently to ensure that the 4 does not infiltrate, therefore, this does not warrant intervention. 4. The 4 tubing should not be used longer than 72 hours. Therefore, labeling the tubing with the date and time would not warrant intervention. Content: Pediatrics, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Evaluation, Client Needs, Physiological Integrity, Pharmacological and Parenteral Therapies, Cognitive Level, Synthesis Chapter 12 Pediatric Health Management 359-60. 1. Abandonment is a reportable offense to the State Board of Nursing in every state. Reportable offenses could result in stipulations made to the nurse's license. 2. This is failure to follow the 5 rights of medication administration, but it is not a reportable offense. 3. Multiple medication errors are a management issue, not a reportable offense. 4. Having an affair with a fellow employee is not a reportable offense. Content: Pediatric, Category of Health Alteration, Mental Health, Integrated Processes, Nursing Process, Evaluation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis 61. 1. A copper bracelet may or may not help the child with rheumatoid arthritis, but because it will not hurt the child, it does not warrant further investigation. 2. Aloe vera is used in many topical burn preparations, therefore, this practice would not warrant further investigation. 3. Vicks VapoRub may or may not help the child's cold, but, because it will not hurt the child, it does not warrant further investigation. 4. Herbal products are not regulated by the Food and Drug Administration, and there is very little, if any, research on herbal use with children. The nurse should at least investigate which herbs the child is receiving before taking further action. Content: Pediatric, Category of Health Alteration, Drug Administration, Integrated Processes, Nursing Process, Evaluation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Synthesis 62. 1. This is an appropriate nursing intervention so that the mother will not have to leave her child, but it is not the first intervention. The child's safety is priority. 2. The nurse could go to the cafeteria and tell the mother to return to the room, but during this time the UAP should stay with the child. 3. The child's safety is priority, therefore, the nurse should have the UAP stay with the child until the mother returns. 4. Social services would not need to be notified at this time. If the mother continually leaves the child alone, then this would be an appropriate action. Content: Pediatric, Category of Health Alteration, Safety, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Safety and Infection Control, Cognitive Level, Comprehension 63. 1. An 18-month-old child should be throwing temper tantrums. This indicates the child is developing a sense of autonomy. 2. An 18-month-old child should cling to the mother and interact continuously with the primary caregiver. A child not interacting with the mother is not meeting the task of developing a sense of autonomy. 3. The child has met the task of trust when he or she cries if the mother leaves the room. 4. When a child responds to his or her name, it indicates a sense of identity, therefore, the task is met. Content: pediatric, category of health alteration, neurological, integrated processes, nursing process, assessment, client needs, psychosocial integrity, cognitive level, analysis 64. 1. An autocratic manager uses an authoritarian approach to direct the activities of others. This individual makes most of the decisions alone without input from other staff members. 2. A laissez-faire manager maintains a permissive climate with little direction or control. 3. A democratic manager is people-oriented and emphasizes efficient group functioning. The environment is open, and communication flows both ways. 4. A democratic manager is people-oriented and emphasizes efficient group functioning. Content: management, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, comprehension 65. 1. Squatting relieves the hypoxic episodes, and the child should be able to remain in the squatting position. 2. The child with a cyanotic, congenital heart defect should have oxygen when being active. 3. This indicates the father does not understand that the child will not be able to participate in active sports because of the stress that is placed on the heart. 4. This behavior indicates the child understands the importance of salt restriction because of potential congestive heart failure. Content: pediatric, category of health alteration, cardiovascular, integrated processes, nursing process,